Hello, welcome to my channel. I am Dr. Drew, Arabian radiologist. This is a sonography-radiology training channel. I will present different videos could be benefit for physicians and general population. In this video series, I will talk about fetus ultrasound and try to explain general information for pregnant women simply. This is the first video in this video series. Ultrasound is the most frequently used imaging modality for assessment of pregnancy. But the first question of every pregnant woman is whether ultrasound is not harmful to the fetus. Ultrasound absorption of the ultrasound waves energy by soft tissue and bone and its conversion to heat are measured by the thermal index. A thermal index of 1 means an increase of 1 degree Celsius. Several studies have suggested a general threshold of temperature elevation of 1.5 to 2 degrees Celsius above maternal core temperature before any evidence of a developmental effect occurs, but it almost always reaches a maximum of 0.6 on ultrasound examination. With modern ultrasound machines, there is only a negligible rise in temperature, usually less than 1 degree Celsius. The World Federation for Ultrasound in Medicine and Biology has stated that a diagnostic exposure that produces a maximum in situ temperature rise of not more than 1.5 degrees Celsius above maternal physiologic levels may be used without reservation on thermal grounds. The conclusion overall is that it is unlikely that there is a deleterious effect of ultrasound in the first trimester during embryogenesis with routine grayscale ultrasound. However, when color Doppler ultrasound is used during the first trimester, it is likely that temperature increases of over 1.5 degrees Celsius may occur, but not definitely. Studies of the effect of Doppler on soft tissues adjacent to bone and nerve conductance demonstrated a significant rise in temperature when the ultrasound beam was held for more than 30 seconds. According to these, MOD imaging should be used instead of spectral Doppler imaging to document embryonic fetal heart rate. But MOD imaging is silent and the mother cannot hear the sound of the fetus heart. However, at the present time, consensus statements conclude that Doppler examination of fetal vessels in early pregnancy should not be performed without a clinical indication, like this first trimester fetus ultrasound that I used color Doppler ultrasound because the fetus is died and this is a case of missed abortion. The mechanical index is another on-screen indicator that provides a rough guide to the likelihood that ultrasound will induce an adverse biologic effect by a non-thermal mechanism, including cavitation. For all practical purposes, this index is probably not relevant for obstetric scanning owing to relative absence of gas bubbles in the fetus. A number of studies have evaluated the effect of prenatal ultrasound on neonatal and infant outcome in animal models. Also, some studies have documented lower birth weights, shorter heights, who were scanned in utero compared with control subjects. The size differences this appeared when studied after 3 months. Neurodevelopmental studies revealed no significant differences in motor and cognitive tasks or in learning skills. Studies evaluating the human fetus and neonate have reached similar conclusions. Studies have found either no difference in birth weights between exposed and non-exposed fetuses, or a difference that, although present at birth, was not present at 6 to 7 years of age. The major difficulties with the studies investigating a possible deleterious effect of diagnostic ultrasound evaluating are threefold. The first one, experimental ultrasound exposure levels or time of exposure often far exceeded those that are normally used diagnostically. 2. The systems used to show ultrasound effect like plants, cell culture, and laboratory animals may not be applicable to humans. And 3rd, many studies that have demonstrated adverse effect in vitro have not been reproducible. AIUM statement on the clinical safety of diagnostic ultrasound reiterates previous findings that no confirmed bioeffects caused by exposure at intensities typical of present diagnostic instruments have ever been reported in patients or instrument operators. At a recent consensus conference on fetal imaging, it was concluded that there is high-quality evidence that ultrasound is safe for the fetus when used appropriately. In conclusion, the sonographer's knowledge of ultrasound and its safety is crucial to the safe implementation of this modality. In view of the rapid growth of sonography and its proliferation into the hands of minimally trained clinicians, it is likely that more patients are harmed each day by misdiagnoses resulting from improper indications, poor examination technique, and errors in interpretation more than all bioeffects. And finally, ultrasound has been in use during pregnancy for the past 45 to 50 years, and it has an extremely good safety record. Only visit a trained professional like radiologists who can interpret the results with accuracy and can detect abnormalities. If you like this video, please subscribe this channel. If you would like to get notification for the next videos, please press the small bell. If you have any question or video suggestion, please write in the comments. Thank you for your attention.